Well, welcome to Bright Star, a brand new chamber member for us. Y'all give Bright Star a round of applause for me. I've got Steve and Jamie Covington here with me, and I'll let them take over in just a second. But let me introduce you to a couple people who are here to help us cut a ribbon. We have Michael Meek, who's the president of the chamber. Michael, thank you for coming. We have our brand new Mayor Pospisil here. Thank you for coming, Mayor.
Welcome to New Braunfels in the chamber.
Thank you.
And a lot of luck and success.
Thank you for coming.
My pleasure.
And the other folks that are here are the Blue Coats, and we're the ambassadors for the Chamber of Commerce. So we'll be able to go out and tell everybody exactly what Bright Star does, where y'all are located, and after, without further ado, you tell us what does Bright Star do? I'm sure everybody might be wondering.
Well, thank everybody for coming out first of all, and we're not new to New Braunfels. We've been here about 20 years. I formerly worked for a company called Autogas Systems. We sold that a couple of years ago to a company out of California.
Oh, okay.
And so it wasn't long after that I got the opportunity to start a new career. And so we looked and looked, and we were really looking for something with a sense of purpose and a mission, so to speak. And so we settled on the Bright Star concept. At least I did initially. It might have been a little hard for my wife. But I looked at it as a business opportunity, and I looked at the medical side as something that we would cover with a good RN. So we found Verwita McGee is right here. She's our director of nursing, and so she provides that clinical oversight. There's a lot of stuff that you have to do with the state to get licensed, and then once you're licensed, there's a lot of things that you have to do to make sure you're staying on top of things, and all of that factors into the quality of care that we provide. And with us, the caregiving is most important. We provide care. We've got 3 service lines, and the pictures here are the branding that denotes our service lines. The orange in the middle is the life care, and if I'm talking to people that don't really get what it is that we do, I'll say home health. But home health oftentimes has the connotation of Medicare, and we're a private duty, private pay organization. So the senior care that we do is private duty, private pay. It could be paid by long-term care insurance. It could be paid by health insurance, and it could be paid out of private funds. Now, the Kid Care line is the green poster, and again, that's anything from sitter service to skilled nursing. We have people that call us just to come babysit their kids. We recruit caregivers, and we seat probably less than 20% of the people that apply for a job, and we have a very rigorous hiring process where we do background checks, drug tests.
We check their competencies visually. We have them show us how to transfer patients, how to make an occupied bed, how to do a bed bath, just any sort of personal assistance skills that they may have to use when they're in the home caring for somebody that has, a medical need.
So the kid care is certainly the sitter service, but it could also be very skilled stuff. Verwita was doing a case this week where there was a 2-year-old with a PICC line in, and getting antibiotics via a IV. So that's a somewhat skilled nursing case. And then we have the staffing line, which is if a doctor's office or a nurse's or a medical facility that I happen to be calling on anyway needs staff, oftentimes it might be more economical for them to continue practicing medicine and let somebody else wrestle with the staffing issues. Since we're doing that anyway, then we can do it. We can put them in there on a temporary basis, and they can make sure that it's the right fit for the job. And we have guaranteed compatibility across all of our product lines. So if something doesn't work out, we'll change out the caregiver. We tell all of our employees when we hire them that we have guaranteed compatibility, and we want our customers to be happy with our service offering. So Was there anything I missed or anything you want to say?
No, you know, our life care line, we do personal assistance all the way up to skilled care. We have caregivers that have worked with, you know, doing grocery shopping, doing laundry, doing baths, light housekeeping, but also from a skilled care level, if at any time they progress in their situation, we have nurses on hand that can also go out and do hourly visits with them. But the beauty of being private duty versus Medicare is that Medicare usually sends somebody in the home just for an hour visit, and they won't do personal assistance, and they won't provide a caregiver unless you're actually homebound and have a skilled need. Where from the private duty standpoint, you can stay as little as an hour, and we're willing to send a caregiver out just for an hour up to 24-hour care, whatever it is you want as the payer. So you know, we chose to do a private duty company versus working with a Medicare facility, and we do partner with Medicare facilities so that if somebody comes in with Medicare benefits and Medicare needs, that we would refer them on. And likewise, we have some Medicare partners that would also be referral opportunities for us.
Does anybody have any questions for them?
Is Bright Star a franchise?
It is, yes, sir. It was started in the Chicago area, and there's like 172 franchisees out there. In Texas, there's 15, 20 of us.
Yeah, at least.
If anyone
one in
watches
Austin, one in
Undercover
San
Boss, they were featured on Undercover Boss.
Ah.
Yes, absolutely. Yeah.
That was our CFO, or our owner.
How big of an area do you cover?
We cover between San Antonio and Austin. It's zip code based, and it's a population of 250,000. It's almost all of Comal, Guadalupe, and Hayes County. Kyle belongs to Austin, so that's kind of one area that I wish we had that we don't, because it's really in growth mode, and there's a lot of new medical facilities there.
Okay.
But, you know, at the same time, we get referrals out of San Antonio and Austin because people that live here end up going there for medical care and then come back home and need help. So it's all about networking and referrals. So if you know of somebody that has a need, we'd be happy to go out to them, sit down with them and talk about our services. And you know, our services are guaranteed, and we don't try to tie people to a long-term contract. It could be 1 hour, it could be multiple hours. We try to hire the best caregivers and provide the best service.
Do you charge by the hour when you do the staggered visitation, you might say? Do you charge by the hour?
Yes, sir.
Yes, sir.
He just dealt with a lot of that 6 months ago or so.
Yeah.
So.
I've been there.
You know about that, don't you? Well, they have lots of brochures and everything behind Gail over there, and y'all make sure and take one if you need one. You've joined a very successful chamber. We hope that you'll get involved with us, join some committees, get to know some of the people here on a little more intimate level, and we welcome you to the Chamber of Commerce.
Thank you.
Y'all give them a hand for me. Okay, let's cut a ribbon. Shop New Braunfels first. Yay!